Hey guys, this is Dr. Brian Mann from University of Miami. One of the questions that I had from a student, it wasn't so much a question, but it was a statement. They're like, you're supposed to do 2 pulls for every push to maintain shoulder health. And I'd heard this before, uh, but I'm not so sure that I agree with this. So I wanted to go ahead and put together this YouTube video just to go over it. My background, for most people who know, I was a strength and conditioning coach for 20 years, and now I'm doing a lot of sports science here at University of Miami. In addition to being a professor of strength and conditioning, right? So let's get to it because I want to take a little bit of a different look at this. So everybody says to balance out the chest muscles, they're on the front. That's why you do 2 pulls for every push. The back muscles are on the back, so you got to balance them out because the lats are on the back and the chest is on the front. So you got to balance. And you need more work on them. It's like, really? Are the lats really on the back and is the chest really on the front? And are you really sure that they're opposing muscles? So that's how you would create balance. Well, let's look here. Let's just go back to anatomy. All right? And for those in strength and conditioning, I think that anatomy is one of the foundational sciences. I think that if you're good at anatomy, you're good at physics, and you're good at math, then you can understand a lot of sports science, and you're going to be pretty well set. You've got a great foundation to build off of. So the pec major. Okay, we've got the origins off of the clavicle, the sternum, and the aponeurosis of the external oblique, and we'll show those here momentarily. They all insert into the greater tuberosity of the humerus. So it is a flexor of the arm. Okay, so it lifts, comes up in the front, performs flexion. It's an internal or medial rotator, and it is an adductor of the arm. Okay, there's the nerve and the blood supply, but that's not really germane for us. Let's look here. Now, this is coming off a visible body. If you need to learn more about your anatomy, I highly recommend Visible Body. It's one of my favorite apps, and I actually use it to teach. So here's the clavicular portion. Why is it the clavicular portion? Well, shoot. Well, the origin's coming right here off of your clavicle, so that'd be a good reason why. Then we've got the sternal portion, okay, that comes off of the sternum. You guessed it. And then we have got the portion, the inferior portion that comes off of the abdominal head and the aponeurosis of the external oblique. Okay. Now, it inserts. How does it insert? Well, look at this. It's not making just the straight fan. If you'll notice, there's actually a twist in the tendon, and that allows it to be able to work on all of the different angles for the actions that it has. So that's pretty cool, man, I think. And then whenever we remove the anterior deltoid, you can really get a good view of that twist and see how it comes over just a little distal to that bicipital groove and inserts into the humerus. So see, the chest is on the front and the lats are on the back, right? There's a chest. We just went over everything, and all that was in the front of the back. And look, the lats. Look right here. Look at the lats. They're in the back. So the two got to balance. Makes perfect sense. So you do the lats to enhance posture, right? Well, what sport uses their lats the most? And my students actually got this right away. Swimming. Swimming uses their lats the most. So swimming, then, should have some amazing posture. Because if they're all lats that we're going to maintain the appropriate position, they should be upright, perfect posture, right? So let's look at it. Man, here's one of the goats, right? How's his posture? Looks like it's internally rotated at his arms, and it looks like he's rounded forward. Let's look at Ryan Lochte. Is that Ryan Lochte? I don't remember. Here's another swimmer with Michael Phelps. And what do we observe? Same posture. Now, here's Michael Phelps with trying to exhibit, well, he's not trying to exhibit, he's exhibiting the best posture that he can. He's locking himself in, he's getting ready for the race. So you think, oh, yeah, no, he's great. Look, his shoulders are back, it's nice and squared off. Let's look at his hands, man. If his arms were completely neutral, his hands, the thumbs would be going straight ahead. What do we notice? His knuckles are what's pointing ahead. And so that's indicating that the humerus is internally rotated still. So the lat, man, let's look at it. Let's just get into this anatomy and see, why is this occurring? How come this is happening? It shouldn't. Origin. Coming off the spinous process. So that's the process that's the one going straight back off of T7 through T12. It's coming off of the lumbar fascia. It's coming off of the lateral surface of the ribs 9 through 12, and it's coming off the iliac crest. So it's a huge origin. It inserts into the humerus. But where on the humerus? That is very, very important. What are its actions? Adduction, internal rotation, and extension. I remember adduction and internal or medial rotation being for the pec major too. Let's look at this. Okay, so we see the lat here again from visible body. We see the iliac crest, we see the thoracolumbar fascia, and we see coming off the spinous processes. Okay. And we see it come up and insert. Ooh, hey, but let's look right here on the arm. If it's going to be in the back for a posterior muscle, right? It should attach on the posterior aspect of the arm. Well, looking deep to the tricep, all I see is bone, but I see this red thing. Where is that attaching? Ooh, here we go. We took the tricep away. It's not attaching on the posterior aspect at all. It flips up. It inserts just slightly medially to the pec major. It inserts into the bicipital groove at the distal end of it, admittedly. Right around the the bicipital groove on the front of the humerus. So we know that a muscle, all it can do is shorten. And remember, some people will tell you that the insertion is the distal most from the joint and the origin is the proximal most of the joint. And yeah, that's true like 70% of the time. Actually, the actual definition is that the origin is the least movable end of the joint and the insertion is the most movable end. And an insertion is drawn to an origin. So if I draw the insertion to the origin, what is going to happen? Well, this arm is going to rotate and then it's going to come forward. Right? That's what's going to happen, and that's what happens to the swimmers. Because the latissimus dorsi doesn't do the opposite of the pecs. It has two of the three same jobs as the pec. Okay. So here we look, and we're going to just look at a quick force couple here, and we see how the internal rotation again can occur, and the adduction can occur for the humerus as a result of the pec major, and we see it as a result of the latissimus dorsi. Okay, especially that adduction, right? Now, with shoulder depression, we need to show that because whenever the upper extremities are weight-bearing, so if you're using a cane, you're using crutches, etc., the reason why you don't lean over to the side and get out of the way is because of the force couple that happens between the pec major and the lat. They're working together, doing the same job of adduction and depression on that on the glenohumeral joint. The depression, though, is going to be done from the pec minor and the lower trap for the scapulothoracic joint. Okay, so are these muscles really opposing? Man, I don't think they are opposing muscles at all. They've got the same function. Both of them are actually, whenever you train them together, yeah, they've got the same insertion point because of that same function, and that training more lats to balance out the pecs is actually going to make the posture worse. It's going to make more internal rotation. It's going to make more adduction. It's just going to make the problem worse and worse and worse. What should we be strengthening then? Well, we got to think about what puts the shoulder in the right spot. So by the shoulder, we mean the glenohumeral joint. We also got to think about what puts the scapula in the right spot. Because remember, the glenoid fossa, it's on the scapula. So if our scapula is not in the right position, our humerus can't be in the right position. So we got to look at both ends. So what's the issue? Most of the time, we're dealing with abducted scapula and upwardly tilted scapula. Strengthening the lats is going to make it worse because of that abduction. It's matching the internal rotation of the humerus, right? So it's going to be turned as a result of that. So what is going to counter that abduction of the glenohumeral joint? Well, we got to look at the horizontal abductor, so the posterior delt. That's going to be a good one to do that. on the glenohumeral joint. But what about on the scapula? Well, of course, it's going to be the adductors of the scapula. What are the adductors of the scapula? Well, our prime movers for that adduction of the scapula is going to be the middle trap and the rhomboids. Now, lower trap is a primary assister on that. So while it is not directly involved, it is. I would still do it because it's going to be good for shoulder health. Okay. Now, upward tilt. What is this upward tilt that I had mentioned? Well, the upward tilt, if we look, our rib cage is curved. Okay, so nothing's ever going to be completely flat. And we've got typically between 10 and 20 degrees of what's called upward tilt coming off of that, off of the plumb line, if you will. So, and also it's 30 to 45 degrees here in the coronal plane. This is, that's called scaption or plane of the scapula. And it's a really, really safe area for the shoulders that you see people going out at like a 30 to 45 degree angle doing like the open cans to really strengthen those musculature of the rotator cuff. And it's good and effective, and it's safe for shoulder strengthening because it's that's the angle of it. You're not trying to fight anything. But backward to that upward tilt. So it's 10 to 20 degrees here. Now, sometimes we can see this coracoid process at the front. The pec minor will pull down and in on it. Remember, it comes off of the 1, 2, 3rd, 4th, and 5th rib. It inserts into the coracoid process, so it's going to pull down and in. If it pulls down and in, the inferior angle goes up and out. And if you go see college students and you see people wearing tank tops, sometimes you'll be able to see some people that it looks like they could hold their chapstick, underneath that little sucker right there, that little pocket, that open space. So those are people that are exhibiting that. So you've got to look at those scapular depressors force couple and that to improve that. So if the pec minor and the lower trap are the scapular depressors, okay, the pec minor is, so that means that they would both pull down, like I had mentioned earlier with the pec major and the latissimus dorsi. Well, the pec minor, if it gets tight, it pulls down and in, causes that to occur. What counters that? Well, it's going to be the lower trapezius. So what are the actions or on the scapula of the pectoralis minor? Again, anterior tilt, elevation as the scapula tips forward when acting alone, depression of the scapula whenever you're kicking in with the lower trap. So again, origins, 3rd, 4th, and 5th rib, insertion of the coracoid process. It is going to be a stabilizer, and it can also elevate the ribs for inhalation, so that's pretty cool. But here we see it from visible body. So 1, 2, 3, 4, and 5 ribs. Here's the origin inserts up here into that coracoid process, so we've got a good view of the pec minor. Now if we look at the trapezius, the traps, it's not a one-stop shop, man. So what I wanted to just show you here is that we've got different actions for the different portions of the trapezius. Now, some of you learned it as trap 1 through 4. At Miami, we just call it upper, middle, and lower to match. That's what I'm calling it, to match the description from the professors of anatomy here. So actions for the upper trap. It's going to elevate, of course, the scapula, the shoulder blade, and the sternoclavicular joint. So then we're going to get some upward rotation and adduction of the scapula. Minorly on the adduction, but there's definitely a lot on the upward rotation. The middle trapezius is going to be adduction. That line of pull, as we'll see here in a minute, it just pulls straight in, man. And the lower trap, it works on upward rotation, but it works by locking the scapula into place. Then it's going to depress and adduct the scapula as well. So let's just look here. The trap is huge. So this part is the upper trap, and this, most people already train this. And sometimes I think this is why our shoulder function gets kind of jacked, because we're training the upper trap but not the lower trap. Why do we train the upper trap, dude? Because it looks cool, man. This huge neck with these big muscles just popping up on top of the shoulders. It looks good, man. People want to train it because it's a muscle they can see. However, the low trap, well, let's look at the middle trap next. And we see the orientation of the fibers. See how they go straight back towards the spine? So anytime it shortens, it's pulling that scapula straight over, trying to pull that medial border closer to the spine, which is a good thing if there's issues with the shoulder health. And then the lower trap, and we see that it runs up at an angle coming to the that spine of the scapula, so it's going to be pulling down and in there to create more stability. Okay, so what now? What do we do then? For shoulder health, man, I don't think it's about pushes and pulls. I don't. Because we see that if we focus on the latissimus dorsi too much, it makes the problem worse. It doesn't make it better. For shoulder health, I believe it's proper musculature, muscular development, and coordination. For some of these things, like the upper rotation of the scapula that uses the upper, lower trap, and serratus anterior, it's all about the timing of it. So that's going to be huge. So what's going to be the proper musculature? What do we need to strengthen? Well, the rhomboids. You're going to need to strengthen the lower and middle traps. We need to stretch the pec minor. We need to stretch the pec major. And we need to stretch the lats. So I think that this is really, if we're focusing on shoulder health, this is just the basic rule of thumb. I think that the 2-to-1 isn't all that it's cut out to be. It's not some savior, as many have brought it out to be. And you know what? I'm going to say this too, that earlier on, I spouted the same rhetoric because it made sense. Once I learned anatomy, I'm like, whoa, hold on a second. That's not how that muscle acts. And I started to question the advice that I was given by other lifters. Now, that being said, I think that this may have been, definitely it was well-intentioned. And they possibly even said it to misdirect, but in a positive way. And what do I mean by that? Is that, hey, if you're really doing a lot of rowing, you should be retracting and then rowing. Well, whenever you do proper form to retract and row, that is going to work the rhomboids and the middle traps fantastically. But what tends to happen is you'll look in gyms across America, and you'll see that people get in, they lock their shoulder blades in place, and then they just get to doing a pump for the lats. They want to feel that muscle pump. So most people don't use that proper form, and they only do the range of motion that they really feel in their lats. They're not hitting those rhomboids. They're not hitting the middle trap. They're definitely not hitting the lower trap because it's not a cool and sexy muscle. So, you know what? I think that it was probably well-intentioned. I don't think it's the best advice. So what do I think that you need to do? If you need to work on your shoulders, stretch the pecs, both of them. Actually, all three heads of the major, and stretch the pec minor. I think you need to stretch the lats. The lats, I think, lat stretching is good for what ails you, man. It seems to do well for lower back pain. It seems to do well for shoulder pain. It even seems to do well for, man, I don't know what it's not good for. But stretching the lats is going to be fantastic. I think it'll help your back pain. I think it'll help your shoulder pain. Okay, guys, that's it. So if you like this information and you want more like it, come join us at the U. I do things like this every Friday, and I think I might post more of those in some of my classes. If the students bring me something, it's like, hey, why is this? Or what's up with this fad diet or this exercise craze? We'll talk about it. So if you're an undergrad or you're looking to get a master's degree in strength and conditioning, come see us here. sites.education.miami.edu, and on that you will just go over to the master's program, and we have got it in applied physiology that strength and conditioning is one of the tracks for. If you are so you could do that for a bachelor's, you could do it for a master's. If you are like, hey man, I've already got all my degrees, I'm just needing some more education, I'm running some continuing education courses here at the University of Miami. The first one is already up. That's an 8-week course that is, unfortunately, it's asynchronously synchronous. Right? So sounds a little bit weird, but you are all working together at the same time, but not at the same time. So just during the course of the week, everybody needs to be on the same page because we're running through discussion boards. We're going to be looking at different topics, reading some things. The first one is just really general. We're going to be bringing out some that are in technology or very, very more advanced specific aspects of training in the near future. And this is one of the ways that I'm going to be able to fund my research, guys. So by taking those sorts of courses, you help me out, and by helping me out, then I'll be able to get some laboratory equipment that's a bit better than what I've got, and be able to tell you, like, hey, here's the answers to these questions. So thank you for your time. If you have any questions, you can hit me up. Social media, I'm at jbrianman. That's Brian with a Y. You could and also reach me. That's Instagram and Twitter. I don't have a Snapchat. Facebook, I'm pretty much full of my friends there. But hey, reach out to me. My email is also bmann@miami.edu. I try and answer all the questions that I can via there, but I've got teaching 21 credit hours this semester. It's getting a little nuts. So I'm extremely busy, but I'm not that popular. It's always easier to get me on social media than it is via email. So guys, that's it for today. Hope you enjoyed it. Hope maybe you learned something. If you liked it, subscribe, like, share, comment, whatever. And we'll catch you next time.